Hello guys, welcome back to my YouTube channel Swastik Dental Academy. Myself Dr. Vikas Kaushik, oral and maxillofacial surgeon. So today we are going to discuss about IV eyelet wiring technique. So in this technique we require wire twister, wire cutter, a probe and 25 cm long equal length wires to make IV loops, maxillary and mandibular cast, and some pre-cut wire of shorter length. So let's start with this demonstration. So first of all we will study how to make IV loops. So for this we have to take a probe and a 25 cm long wire. Okay. Then put the probe in the center of this long wire and make a loop. Try to make a loop around the probe. Okay. Am I clear? Now hold this probe in your left hand and hold this wire with wire twister and lock it. Now twist the wire 3 times to form a loop. 1, 2 and 3. Now unlock it and you are able to see this IV loop. See, this is the IV loop with ends which are of equal length. So guys, now we have made around 8 IV loops, and now these loops will be used for maxillary and mandibular fixation. So let's continue with this video. Guys, we have to select 4 teeth in each quadrant. For example, first molar and second molar, canine and premolars. Same in this quadrant, canine and premolar, and first and second molar. First of all, we will place this IV loop in molar region. So these 2 tail ends are passed through the 2 selected tooth from buccal to lingual side, like this. Okay. Now one wire is taken towards mesial side and passed into buccal side. This is the mesial side of first molar. Okay. Now this wire is taken towards the distal side and pass this wire through the IV eyelet loop. So we are passing this wire from the distal aspect of second molar. Okay. Now this is the mesial part, mesial end, and this is the distal end. So this distal end will pass through this IV eyelet loop, like this. Okay. Now this distal end meet at this point with this mesial end. Distal end is meeting here. So we have to twist this wire here. Now twist the both wires together like this. Okay, am I clear? Now cut this excess wire with wire cutter. Okay, and twist it around the gingiva, towards the gingiva. Am I clear? So in this way we have done with this molar region. Now we will do the same procedure in canine and premolar region. So we have done the same procedure for maxilla also. 2 eyelets in each quadrant, and for mandible 2 eyelets in each quadrant. So how we will secure maxilla with the mandible? So we have to pass the wire from maxilla and mandible eyelets and twist and thread the wire ends together. Okay, so we will pass this wire from these eyelets, as you can see. Okay, now we will twist and thread these wires together. Okay, are you able to see? Now twist and thread the end of the wires together. Okay, now cut the excess wire. Now we will repeat the same procedure with canine premolar region. So guys, we have done with this procedure. Eyelet maxillary wiring technique on both sides, and maxillomandibular fixation has been achieved, as you can see. Okay, so guys, thank you so much for watching my video. Please do like, share, subscribe and comment on my YouTube channel and on this video. Thank you.